in the health plan side of it, we start off with a coverage document that says what is paid for and what isn't. And in our world, 75% of our customers are employers. They make cars, they make other things, and they have lots of employees, and part of a condition of employment is that they receive certain benefits. And one of those benefits is health plan coverage. And each of these employers has a document that says this is covered, this isn't covered. And then they look for someone to administer their health plan coverage arrangement. And they send out an RFP, Blue Cross responds, and we end up getting the contract for a lot of customers. So we have literally tens of thousands of different coverage documents based on what the employers came up with. So when we talk about complex rules, these coverage documents do tend to have some common language in them, such as we will only cover a service if it's been established by evidence-based medicine as something that is sort of proven to work. We will not cover it if it is investigational, experimental. So then that opens the question, when is it investigational, experimental? And that's what we call medical policy. We create policies that are the same throughout Blue Cross, that if you have a coverage document that says it's investigational, these are all the services that are investigational. These are the services that we have evaluated, and there is medical evidence in the literature saying that patient outcomes are improved, and therefore it meets our standard for coverage and not being subject to that exclusion. This medical policy is based on literature, and that's kind of a key point, because it takes a long time to get the IRB, the preclinical stuff, the FDA. Then you have to start saying, okay, we're doing these studies, and the studies can take a long, long time. But we do not take information unless it's been published.